You know that quiet moment in the morning. The coffee is brewing. You stand by the kitchen counter and open that little plastic pill organizer with the days of the week snapped shut on top. Monday, Tuesday. You pop out a few pills. You swallow them down with a sip of water. You do it because you have done it for years. You do it because maybe 10 or 15 years ago, a doctor wrote it on a prescription pad and it made you feel better. Everything feels completely normal. It is just part of the routine. But there is something happening quietly beneath the surface. Something most of us never stop to think about. The body you have at 65 or 70 or 80 is not the exact same body you had at 45. It does not process things the same way. The internal filters, like your liver and your kidneys, have changed their pace. They hold on to things longer. And yet many of us are still asking our older bodies to handle the exact same routine of chemicals we used decades ago. Sometimes we wake up feeling a little groggy. Sometimes we get a strange dizzy spell when we stand up from the armchair. Sometimes we feel a brain fog that we just write off as getting older. But what if it is not just age? What if the very thing you are taking to fix a problem is now the exact thing causing the trouble? Today we are going to look at certain everyday medications that medical professionals know often cause more harm than good as we get older. These are the habits we might need to rethink. Let us talk about why this happens. It is not because you are doing something wrong. It is simply because of how our bodies evolve. Think of a man named Thomas. Thomas is 72 years old. He takes pride in taking care of his own home. He loves the smell of cut grass when he mows his own lawn. He drives to the hardware store on weekends. He feels strong and capable. Thomas has been taking the same set of medications for 15 years. But recently he has been feeling a little off balance. His mouth is always dry. He forgets why he walked into a room more often than he used to. Thomas thinks this is just what happens when you cross into your 70s. He tells himself it is just age. But what Thomas does not see is how his body processes what he puts into it. When we are young, our liver and kidneys are incredibly efficient at filtering out medications. They grab the chemicals, do the job, and flush the rest out of the system quickly. But as the decades pass, those organs naturally slow down. It is not a disease. It is just the natural wear and tear of a long and active life. Because the filtering system is slower, a pill that used to leave your system in 8 hours might now stick around for 24 hours. And if you take another pill the next day, before the first one is completely gone, they start to stack up inside you. You are getting a larger dose than you realize, simply because your body is holding on to it. Medical experts actually have a name for the list of medications that become risky as this change happens. They call it the Beers criteria. It is not a list of bad medicines. It is a list of medicines that work perfectly fine for young people, but start to cause strange side effects for people over 65. And the tricky part is that many of these medications are sitting in your bathroom cabinet right now. You can buy them without a prescription. You have trusted them your whole life. Let us start with something very common. It is 2 in the morning. You are staring at the bedroom ceiling. Sleep just will not come. You do not want to bother your doctor for a prescription. So the next day, you go to the pharmacy and buy an over-the-counter sleep aid. It comes in a blue box. It usually has the letters PM at the end of the name. You take it that night and you finally get some rest. It feels like a quick and easy solution. But here is the catch. Most of these over-the-counter sleep aids rely on a very old ingredient called diphenhydramine. This is actually a medication originally meant for allergies. It just happens to make you drowsy as a side effect. When you are 40, your body clears it out by morning. When you are 70, that medicine stays in your bloodstream well into the next afternoon. This creates a problem that many people mistake for early dementia. You wake up feeling heavy. Your thinking is cloudy. Your mouth feels like it is full of cotton. And most dangerously, your balance is slightly off. You might stand up from the edge of the bed and feel a little wobble. For a younger person, a wobble is nothing to worry about. For someone older, a wobble can lead to a fall. And a fall is the exact thing we want to avoid at all costs to protect our independence. It goes even deeper than just feeling sleepy. Medicines like diphenhydramine block a chemical in the brain called acetylcholine. Acetylcholine is crucial for learning and memory. It is like the oil that keeps the gears of your mind turning smoothly. When you block it, you start forgetting things. You struggle to find the right word in a conversation. You feel confused in familiar places. Many older adults experience this and get terrified. They secretly worry they are losing their mind. They do not tell their children because they do not want to cause panic or lose their freedom. They just suffer in silence. But in many cases, it is not age, and it is not a terrible disease. It is just the blue pill they took the night before, lingering in a body that cannot clear it away. Now let us look at another habit that sneaks up on us. Pain. We all deal with it. Maybe it is an old injury in the knee from playing sports years ago. Maybe it is a lower back that aches when the weather turns cold and rainy. To handle this, millions of people rely on common pain relievers. These include famous names like ibuprofen and naproxen. You probably have a bottle of them in your kitchen drawer right now. You have been taking them for occasional headaches since you were in your 20s. They feel as safe as a glass of water. But as we cross the threshold of 65, these trusted friends start to act differently inside us. Remember how we talked about the kidneys slowing down? These common pain relievers are very hard on older kidneys. If you take them every single day for chronic pain like arthritis, they force your kidneys to work under immense stress. But the body does not scream when this happens. It just quietly struggles to keep up. There is another side to this story that often goes unnoticed. These common pain relievers affect your blood vessels. They can cause your body to hold onto salt and water. What happens when your body holds onto excess fluid? Your blood pressure goes up. This creates a fascinating and frustrating cycle that happens in doctor offices every single day. Imagine a woman named Sarah. Sarah is 68 years old. Her hip hurts every morning, so she takes ibuprofen with her breakfast to get through the day. After a few months, she goes in for a regular checkup. Her doctor measures her blood pressure and notices it is far too high. So the doctor writes a prescription for a new blood pressure medication. Sarah goes home now taking a pain pill and a blood pressure pill. She does not know that her high blood pressure was actually caused by her daily pain reliever. She is taking a new drug to fix the hidden side effect of an old drug. In the medical world, this is called a prescribing cascade, and it is incredibly common for older adults. And we cannot ignore what these daily pills do to the stomach. When we are young, our stomach lining is thick and resilient. It can easily handle these harsh pain relievers. As we get older, that protective lining naturally becomes thinner. Taking these medications day after day dramatically increases the risk of stomach bleeding. And the terrifying part is that you might not even feel a stomach ache at first. The first sign of trouble might be feeling incredibly weak or out of breath, simply because you are losing blood internally without realizing it. This is why relying on these common pills for daily pain management becomes such a risky game as the years go by. It does not mean you have to live your life in pain. Nobody wants that. It just means the old tools do not fit the current job anymore. There are other ways to manage pain. There are physical therapies and different types of medications that do not put your kidneys and your stomach on the front lines of the battle. So far, we have talked about the things we buy ourselves, the sleep aids from the pharmacy aisle and the pain relievers from the grocery store. We choose them because they are convenient and familiar. We trust them because they have always been there when we needed them. But the story gets much more complicated when we look at the medications our doctors prescribe for us. The things we take because a trusted expert told us to. Sometimes a prescription is written for a very specific crisis in our lives. A moment of intense stress at work, or a sudden spike in health issues after losing a loved one. We take the pill and it helps us get through the dark days. But the crisis passes. The years roll on. And we just keep taking the pill year after year. We never stop to ask if we still need it. And sometimes our busy doctors simply forget to tell us to stop. We will look at the nerve calmers and the pills that change how our brain handles stress. We will see how holding on to them for too long can slowly drain our energy and steal our balance without us even noticing. Let us look at a group of medications that doctors often prescribe when life feels overwhelming. These are known as anti-anxiety medications or sedatives. You might recognize them by names that often end in PAM or LAM, like diazepam or alprazolam. The brand names are deeply familiar to many. They are prescribed when someone is going through a bitter divorce, dealing with the sudden loss of a spouse, or facing an intense period of stress. And in those moments of crisis, they can feel like a lifeline. They calm the racing heart. They silence the endless loop of worry. They let you breathe again. But these medications were never designed to be lifelong companions. They are meant to be a bridge over troubled water, not the road you travel on forever. Yet thousands of people in their 70s and 80s take them every single day simply because no one ever told them to stop. When you take these sedatives over a long period, especially as an older adult, they start to change how you experience the world. Remember how we talked about the body holding onto chemicals longer? This is where it becomes incredibly dangerous. These sedatives can accumulate in your system, creating a constant low-level state of intoxication. You might not feel high, but your reflexes are dulled. Your reaction time slows down. Imagine walking to the mailbox on a crisp autumn morning. There is a slight unevenness in the sidewalk where a tree root has pushed the concrete up. When you are 50, your foot catches it. You stumble slightly, but your brain instantly sends a signal to your muscles to adjust. You catch your balance and keep walking. When you are 75 and your system is carrying a heavy load of long-term sedatives, that instant signal is delayed. By the time your brain tells your foot to adjust, gravity has already won. This is why medical professionals consider long-term use of these medications a significant fall risk for seniors. A fall at 70 is not like a fall at 30. It can mean a fractured hip. It can mean weeks in a rehabilitation center. It can be the event that finally forces someone to leave the home they love and move into assisted living. And sometimes the cause of that fall is sitting quietly in the medicine cabinet, disguised as a little pill that helps you relax. There is another deeply concerning effect of these medications that often gets misdiagnosed. Over time, they can blunt your emotions and cloud your thinking. You might find yourself losing interest in your hobbies. A grandfather who used to love woodworking might stop going out to his shop. A woman who loved gardening might just sit in her chair and watch television all day. Their families might look at them and think they are just getting old and tired, or worse, they must be getting depressed. Sometimes a well-meaning doctor will see this lethargy and prescribe an antidepressant. Now the person is taking a pill that slows them down and another pill to try and lift them up. It is a chemical tug-of-war inside a body that just wants to find its natural balance. The truth is, in many cases, if they slowly and carefully stopped taking the sedative, the fog would lift. The energy would return. The woodworking tools would come back out. They were not losing their spark. The spark was just being smothered by an outdated prescription. Now let us shift to something that feels much more physical. Let us talk about muscles. Many people deal with muscle spasms or back pain, and doctors will sometimes prescribe muscle relaxants. These drugs sound exactly like what you need when your lower back is locked up in tight knots. They are supposed to tell the muscles to let go and relax. But here is the truth about how most muscle relaxants work. They do not actually go to the muscle. They go to the brain. They work by depressing your central nervous system so that your brain stops sending the signal to the muscle to stay tight. They are, in a way, full-body sedatives. For a younger person with a pulled muscle, they might cause a bit of drowsiness. But for an older adult, the effects can be overwhelming. They can cause profound confusion, severe dry mouth, and once again a terrifying loss of balance. It is like trying to walk through deep water. Your legs feel heavy and uncoordinated. Consider a man named Robert. Robert is 80 years old and takes pride in his daily walks around the neighborhood. One week, he pulls a muscle in his back while lifting a heavy box. His doctor, meaning well, prescribes a common muscle relaxant. Robert takes it, and within hours his back feels a little better. But the next day he feels so unsteady on his feet that he decides to stay inside. He feels disoriented, as if he cannot quite focus on the television. He feels weak. This is the hidden cost. The medicine might relax the back muscle, but it relaxes everything else too, including the sharp mind and steady feet that Robert relies on to stay independent. Medical guidelines strongly suggest that older adults should avoid most muscle relaxants. The risk of falls and confusion is simply too high, especially when other treatments like targeted physical therapy, heat, or gentler pain management strategies can solve the back pain without clouding the brain. Let us look at another category that often surprises people. It involves something deeply personal: bladder control. As men and women age, changes in the bladder are incredibly common. Sometimes there is an urge to go that comes on too quickly. To help with this, doctors often prescribe medications for an overactive bladder. These medicines belong to a class called anticholinergics. We mentioned that word earlier when talking about sleep aids. It means they block that crucial brain chemical acetylcholine. These medications do work to relax the bladder muscle. But the body is a deeply connected system. You cannot just block acetylcholine in the bladder without affecting it everywhere else. And the place where you need it most is the brain. Taking strong anticholinergic medications every day is like slowly turning down the lights in a room. Things start to get dim. Memory becomes patchy. Focusing on a task becomes difficult. Some older adults taking these medications begin to show signs that look exactly like dementia. They get lost driving to familiar places. They forget the names of close friends. This creates a heartbreaking situation for families. They see their loved one slipping away, and they assume it is Alzheimer's disease. They begin making plans for memory care facilities. They grieve the loss of the person while they are still sitting right there. But in a shocking number of cases, the confusion is entirely chemical. It is the bladder medication blocking the brain from working properly. When the medication is stopped, the dementia miraculously disappears. The lights come back on. This is why understanding what we put into our bodies is not just about avoiding stomach aches. It is about protecting our minds, our identities, and our fundamental connection to the people we love. It is about realizing that treating a physical inconvenience like a frequent need to use the restroom should never come at the cost of our cognitive clarity. We still need to look at the last two items on our list. These last two are perhaps the most common of all. They are so deeply woven into our daily routines that we hardly even consider them to be medicine anymore. Let us talk about the end of the day. You have just finished a nice dinner. Maybe it was a bit heavy, or maybe it had a little too much spice. You know from experience that if you do not do something, you will wake up with that burning feeling in your chest. So you reach for a heartburn pill. These are often called acid reducers. You can buy many of them right off the shelf at the grocery store, while others are prescribed by your doctor. You take one every day, sometimes before you even eat, just to build an invisible shield. You have been doing this for 5, 10, perhaps even 20 years. It works perfectly. You never get heartburn anymore. But let us think about what that pill is actually doing. It is designed to turn off the acid production in your stomach. And if you have an ulcer or severe damage, turning off the acid for a few weeks is exactly what your body needs to heal. It gives the tissue a chance to recover. But your stomach acid is not a mistake of nature. It is not just a nuisance. It is a vital tool. You need that strong acid to break down the food you eat. You need it to pull the essential vitamins and minerals out of your meals and send them into your bloodstream. When you take these strong acid reducers every single day for years, you are effectively leaving your body without its primary tool for absorbing nutrients. One of the most important minerals that gets left behind is calcium. Without enough acid, the calcium from your food and your supplements just passes right through you. Over time, your body has to start stealing calcium from your own skeleton to keep your heart and muscles working. Your bones slowly become hollow. They become fragile. You do not feel this happening. There is no pain when a bone loses its density. But one day you might bump your hip against the edge of the kitchen counter. A bump that would have meant nothing 10 years ago suddenly results in a fracture. You might think it was just bad luck or a natural part of aging, but often it is the silent result of a stomach that has been artificially turned off for a decade. Medical experts now strongly advise that these powerful acid reducers should be used for the shortest time possible. They were never meant to be a permanent part of your diet. Now we arrive at the 7th and final medication on our list. This one requires careful attention because it deals with how our body manages energy. For millions of older adults, keeping blood sugar levels steady is a daily job. You check your numbers, you watch what you eat, and you take your medication. It is a serious responsibility. Many years ago, doctors commonly prescribed a certain class of blood sugar medications that work by forcing the pancreas to pump out insulin as hard as it can. They are very effective at driving blood sugar down. But as we get older, our bodies lose the ability to bounce back from sudden internal changes. When these older medications push the pancreas too hard, the blood sugar does not just go down to a normal level. It crashes. It drops dangerously low. If you have ever experienced a severe drop in blood sugar, you know how terrifying it is. It does not feel like a gentle hunger. It feels like the floor is dropping out from under you. You break out in a cold sweat. Your hands shake uncontrollably. Your heart races. You feel weak, confused, and desperate. For an older adult living alone, this sudden crash is a profound danger. It can happen in the middle of the night. It can happen while you are walking down the stairs. It leads to severe falls, sudden confusion, and emergency room visits. The tragic part is that many older adults mistake these sudden crashes for heart problems or a sudden onset of weakness. They do not realize it is their own medication pushing their system entirely too hard. Medicine has advanced incredibly over the last few decades. Today, there are newer, much safer ways to manage blood sugar that do not carry this high risk of sudden crashes. The old tools are simply too blunt for a system that needs gentle, steady management. So here we are. We have looked at 7 different types of medications: sleep aids, daily pain relievers, sedatives, muscle relaxants, bladder medications, long-term acid reducers, and older blood sugar pills. You might be recognizing some of the names we talked about. You might be thinking about the bottles sitting in your own home right now. You might be connecting the dots between a pill you take and a feeling of grogginess or unsteadiness you have been experiencing lately. This realization can bring up a lot of emotions. You might feel a little angry that no one told you this sooner. You might feel anxious about what to do next. That is completely normal. The most natural instinct right now might be to walk into the bathroom, grab the bottles, and throw them straight into the trash. But you must not do that. Your body, even if it is struggling with a medication, has adapted to having it. It has built its daily rhythm around that chemical. If you suddenly take it away, your body will react sharply. Stopping medications cold turkey can cause severe withdrawal, sudden spikes in blood pressure, or a massive return of the original symptoms. It is a shock your system simply does not need. Instead, you are going to do something much more powerful. You are going to practice something the medical community calls deprescribing. Deprescribing is not about denying you the care you need. It is like a spring cleaning for your body. It is a careful, supervised process of reducing doses, switching to safer alternatives, or slowly weaning off medications that no longer serve you. It is about removing the chemical clutter so your natural energy can shine through again. Here is exactly how you start. The next time you have a doctor appointment, do not just bring a list of your medications. Bring the actual bottles. Put them all in a bag. Bring them into the exam room and line them up on the table. Show your doctor everything. The prescriptions from other specialists, the pain relievers you buy at the grocery store, the vitamins, the sleep aids, everything. Then you ask 3 simple but profound questions. First, ask, do I still need this? You would be surprised how often a doctor will look at a bottle and say, actually, no. We only meant for you to take that for 6 months, not 6 years. Second, ask, is this medication considered safe for someone my age? Mention the Beers criteria. Let your doctor know that you are aware your body is changing, and you want to make sure your medications reflect those changes. Third, ask, can we lower the dose or find a gentler alternative? You are not demanding to stop all treatment. You are asking for a treatment plan that respects your older, wiser, but perhaps more sensitive internal systems. Doctors are incredibly busy. They often only have 15 minutes to see you. They are trained to add a medication when there is a problem. They are not always trained to look for things to take away. By bringing your bottles and asking these questions, you are changing the dynamic. You are becoming a partner in your own health. You are guiding the conversation. Let us go back to that quiet morning in the kitchen. The coffee is brewing. You stand by the counter and look at the plastic pill organizer. But this time the feeling is different. You are not just swallowing pills blindly out of habit. You have had the conversations. You have worked with your doctor to slowly clear out the things that were holding you back. Maybe the pill organizer has a few empty slots now. Maybe your head feels a little clearer when you wake up. Maybe your step is a little steadier when you walk out the front door to get the mail. You realize that getting older does not automatically mean feeling foggy, tired, or dizzy. Sometimes the fog is not the years. Sometimes the fog is just the things we carry with us that we no longer need to carry. You have the power to ask the questions. You have the right to a clear mind and a steady footing. Take your time, talk to your doctor, and give your body the exact support it needs for the person you are today.